Hi, in this quick video, I want to talk to you about a very important medical topic, fatty liver disease. And do you have it? And if you do, how can you detect it? That's what I'm going to talk about in this video today. This is very important stuff. Now, before we get started, please take 1 second and click the subscribe button. It's right down there. See that? Click that button. And that way, every time I get a bright idea, you'll be one of the very first people to know. Now, let's talk about fatty liver. Do you have it? How can you tell? Okay. Now, fatty liver, first of all, why is this even important? What's fatty liver? What the heck is that? Fatty liver is now one of the leading causes of liver failure and people being on the liver transplant list. Forever and ever in medicine, we thought that people were on the liver transplant list either because they drank too much alcohol or they took too much acetaminophen, right? Or they had hepatitis and just destroyed their liver. And it was usually a lifestyle or a choice related thing. And once again, now the leading cause of fatty liver is still a lifestyle choice, a diet choice, but no more is cirrhosis of the liver and hepatitis. No longer are those things the leading causes that people's liver fail. Now, one of the leading causes is fatty liver disease, which is a self-inflicted condition. Can you believe that? That's unbelievable to me. When I first read it, I had to reread it again. I couldn't believe that was true. So, fatty liver, it's a huge medical problem. It's a very, very serious risk. Now, if you're overweight, you may have fatty liver. If you have insulin resistance, you probably have fatty liver. If you have type 2 diabetes, you almost certainly have fatty liver. Here's how you can tell. So the symptoms. What are the symptoms of this? There's really no specific symptoms of fatty liver. There can be some vague symptoms, abdominal discomfort, a protruding abdomen, or you can just not feel well. Something's not right. Maybe fatigue, but those are all general symptoms, right? That could be related to anything. So what you have to do is you have to go see your doctor that you trust, and you have to get some lab work checked and maybe some imaging studies done to see if you have fatty liver or not. When you go see your doctor, what signs are there that you might have fatty liver that he'll see? Well, you might have a protuberant abdomen, right? Your belly might be sticking out. That could be fatty liver. Your skin pallor. If you have a terrible fatty liver, you may have some skin color changes, but maybe not. So he's going to check some lab work, and I'm going to tell you the lab work that you need to have checked. And your doctor should know this, but jot these tests down just so that you have a complete list and you make sure everything gets checked. The first thing you want to check is a complete metabolic panel, a CMP. That's number one, and that tests your liver from several different angles. It also looks at a test called alkaline phosphatase, which is also important, that can give you a heads up that something's not right with the liver or other organs. Also, you need a GGT, a gamma glutamyl transferase, GGT. That's a good specific test for liver damage and damage to the biliary system in general. Next is a C-peptide, because if your C-peptide is elevated, then that means you're becoming or are insulin resistant, and that's almost invariably linked to fatty liver. The next one is a hemoglobin A1C. If it's even 1/10 of a point elevated, then you are probably insulin resistant, which, as I just said, goes hand in hand with fatty liver and fat in your pancreas. So what kind of imaging tests should your doctor order? Well, you want to minimize radiation as much as you can. We all know that. So the first test is an ultrasound of the abdomen, right? And this will look at all the abdominal organs, not just the liver. But the liver is really what we're going to focus on in this video today. And so they need to look for signs of fatty streaking or fatty deposits in the liver. They also need to look for that in the pancreas as well. If you are too overweight, they may not be able to see your liver and pancreas clearly enough, and so you may have to have a CT or a CAT scan of the abdomen. There is some radiation involved in this, but not nearly as much as there was even 5 years ago. Okay, and so then with the CAT scan of your abdomen, they can see very clearly if there's any fat in the liver or in the pancreas. Have you had any of these tests? Leave me a comment below, yes or no. Have you had this checked? Have you been checked for fatty liver? Because it's a big deal. Now, here's a little extra tip. Make sure that you ask your doctor to ask the radiologist who will be interpreting the ultrasound and the CAT scan to comment about the presence or the absence of fatty liver. And here's why. A lot of people don't realize this, but there are many radiologists out there who see so much fatty liver in abdominal ultrasounds and CAT scans that they consider it normal. They don't even comment on it on the report that your doctor will get back. And so they may say liver's normal, but if your doctor lets the radiologist know, hey, I'm looking for fatty liver, then he'll say, oh yeah, there's some fatty streaking in this liver. Otherwise, he may not even comment, and then get the false impression that your liver has no fat deposit in it. So make sure you tell your doctor, hey, could you ask the radiologist specifically about fatty deposits in the pancreas and in the liver on the ultrasound or the CAT scan, whichever you decide to order. And your doctor, he may flare up at this a little bit, but if he does, then you just taught him something, because that means he didn't know to ask for that. I found that I have very good radiologists in my area, but I've had to call them more than once and say, are you sure there was no fatty deposits in this liver? And they'll look at the scan again and say, well, yeah, but I mean, that's, most people this age and most people who are overweight have fatty liver. And I'm like, yeah, but dude, that's a huge medical risk factor. I want you to put that in your report. And so now they do that for me, and they'll do it for your doctor too if he asks. Okay. Now, if you know someone who has a protuberant belly, who's a little overweight, who has type 2 diabetes, they need to know if they have fatty liver disease or not. It's huge. It's a huge medical problem. The way they're going to find out to even know to ask this question is if you share this video. Share it on Facebook, share it on Instagram, share it on Twitter, share it wherever, but help your people figure out, do they have fatty liver or not? You could even send this video in an email to your uncle in Minnesota who is overweight and doesn't know that he has fatty liver. You could save his life. Now, if you really enjoy my videos and you want to help me make more videos in the future, click the link down for my Patreon page. It's down below. I have patrons helping me now, give me more time to make these videos, and you could help out too. This is Dr. Barry, and I will see you next time.